Pleasant good morning. Good morning. This is Sharon Benjamin from Natural Living Center. Listen, today I really want to revisit something I spoke about some years ago, and that has to do with the female reproductive system, the health of women. So many women are dealing with fibroids or uterine, fibroids, PCOS, endometriosis, okay, and even further, cervical cancer. We are seeing a lot of that now. I want to really do a little series concerning this thing, but today I'm just going to do like a broad overview on what this thing is. It is dangerous, and women begin to suffer with this thing from the time menstruation starts, in so many young girls. But the fibroids the fibroids is like a tumor, but in most cases they are benign. All right, but even though they are benign, it is still dangerous to the reproductive system. In the rare case you find a fibroid that is cancerous. I've seen that before. All right, but the fibroid itself, it causes a lot of pain, depending on the size of it, a lot of discomfort. All right, complications during pregnancy, heavy menstrual bleeding. Some people, some women, they would use 2, 3, 4, 5 feminine napkins a day. All right, and it is soaked up in no time. What happens when you're losing all that blood? Eventually you become anemic. You have iron deficiency, folic acid deficiency, B12 deficiency, different types of anemia. But when that starts to happen now, you start to feel tired, sick. All right, so with the anemia, it comes with a kind of lethargic kind of feeling that you get. In the midst of all of this, your mood will be all over the place. You will have these mood swings. You also have things like PCOS, which is polycystic ovarian syndrome. Even with that, you're having irregular menstrual cycles. You have a dysfunction in the ovulation, so it is that itself is thrown off. All right, metabolic issues. With the metabolic issues, you come now to start to deal with insulin resistance. So this is why, if you're going to the doctor and the doctor telling you, you're dealing with PCOS, most times the doctor will put you on metformin, which is a diabetic drug. What they're doing, they're trying to regulate your pancreas. Why? Because it goes all the way back to your endocrine gland. So it comes back now to what are you putting in that is affecting that endocrine gland. All right, so we're going to go deeper into that as I go into this thing. So it, because of the insulin resistance now, it gives you an increased risk of type 2 diabetes. All right, and we still be dealing here with PCOS. You see weight gain. Also with PCOS, you see sometimes the stomach starts to get high. The stomach could also get high with fibroids, depending on the size, because some women have fibroids the size of a grape. You have multiple fibroids. You have fibroids the size of a lemon, a football. Some women. All right, so you also have endometriosis. The endometriosis causes chronic pelvic pain. That is the thickening up of the uterine walls. All right, you see infertility, you see adhesions taking place inside of the endometrial tissue. Also, you have a very reduced quality of life. When the period does come, some women can't even function with this thing, but it's very common. And we have reached a place in society where we tell ourselves, well, okay, it's just the norm. This is just what I'm dealing with. No. this is something that you need to fix. Many women, you want to have children, you get married, you want to have children. When you're dealing with these things, it is difficult. And even when you do get pregnant, most times it's because there's premature birth or you lose your baby, as a result of what's going on here. Now, the last thing I'm going to deal with is ovarian cancer, uterine cancer. The thing with uterine cancer is that many times it is symptom free. In the early stages, you don't even know that this is what you're dealing with. So in many cases, they call it like a silent killer, because the thing kills, and you don't realize that this is what you're dealing with most times until it has reached the advanced stage. All right, and when you have a late diagnosis now, it's very difficult, but it does have a high mortality rate with ovarian cancer. And what the doctors will tell you is that you have limited treatment options, radiation or chemo, things like that they tell you. Sometimes, most times they tell you need to have a hysterectomy, whether it's a full hysterectomy or partial hysterectomy. But you need to learn about your body. But in this case here, when you're dealing with the female reproductive system, you have to go all the way back to your glands, and you have to understand what these glands do. You have to understand what causes these glands to shut down. And even though we're looking at the womb here, it also involves the breast tissue. Many women dealing with breast cancer, or you're seeing lipomas showing up in the breast tissue as well. Now, here at Natural Living Center, you can come in and we can look at you, we deal with this, we can put you on treatments to reduce these fibroids, we can put you on treatments to eradicate PCOS, we can put you on treatments to take care of endometriosis and uterine cancer as well. And we also have this formula here is the female reproductive formula that you can put in juice, you can put it in a tea, to help, because this goes across the board dealing with these 4 things that I just talked about. So I'm going to go deeper into these things as the weeks progress to let you know. This female reproductive formula is $120 TT, that's TT dollars. All right, you can get it at any of our stores, whether it's at the Shalford Court branch in Port of Spain, or you can get it at the Aruka branch, 189 Eastern Main Road, Aruka. You can call us to make an appointment to come in to have a scan done, or to come in to get treatment done. If you have your doctor's report, it will just be a case of you coming in to get treatments done. Call us so that we can give you more information on how it works. But yes, you can get rid of it. I know it is something that many women dealing with for many years, and most times you are told that when you reach menopause that you don't have to go through these things. But I can tell you, there are women who are going through menopause and they're still dealing with uterine cancer. Many women going through menopause and they're still dealing with uterine fibroids, so make up your mind and get yourself together. You want to have children, you want to have a healthy reproductive system, give us a call. Call us 623-8209 or 692-7097 or 707-6978. If you're calling from abroad, the international code is 1868, because we are in Trinidad. All right, 1868. You can put any of the numbers. All right, so get your health on track. You could fix it. You can fix it. Do not go through all this set of suffering with something that is easily fixable. All right, so do have a blessed day. All right, give us a call. You can find us on Facebook, Instagram, all right, even YouTube. You can find us. Call us or message us so that we can give you some more information. Have a good day.